Today we're going to take a quick look at Medicare Parts A and B. Hi, Daryl Russell, licensed agent and Director of Training at Affordable Medicare Supplements, or AMS. And today we want to take, in about 5 minutes, an overview of Medicare Parts A and B, what you get and what your benefits and premiums are going to be. So let's go ahead and take, first of all, a quick look at how you qualify for Medicare Parts A and B. You become eligible for Medicare one of three ways. The first day of the month that you turn 65, even if you're still working and covered by your employer's group insurance or even a spouse's employer's group insurance. Secondly, after 24 months of Social Security disability benefits, regardless of how old you are, Medicare coverage starts the first day of the 25th month that you receive Social Security disability benefits. And thirdly, regardless of how old you are, if you're diagnosed with Lou Gehrig's disease, ALS, or end-stage renal disease, permanent kidney failure requiring dialysis, you would become eligible for Medicare Parts A and B. And you must have Parts A and B to be fully insured under Original Medicare. So let's take a closer look at what you get and what your costs are under Medicare Part A. Part A is your inpatient hospital coverage, and it starts with a deductible for hospitalization, and you see it starts off at $1,408 per benefit period, and these numbers are for calendar year 2020. There's also a copay after your deductible, but for the first 60 days you can see that copay is zero. It does go up to $352 for days 61 through 90, and even higher for days 91 through 150. But that's a conversation for another video. In your skilled nursing coverage, again, this is where you would be admitted, you see that Medicare pays all for the first 20 days. You pay nothing. But keep in mind, this is for short-term care. Typically, you're getting physical therapy, speech therapy, occupational therapy, perhaps after a surgery or an illness. And you're going to get better medically and you're going to be able to go home. So that's the type of care. After the 20 days are up, you have a copay for $176 per day for the final 80 to a total of $100. Medicare does cover home health care, but it is very limited, and that's zero cost to the member, as well as hospice care for the terminally ill at $0 typically. So what is Part A premiums? Well, most people with 40 quarters of Medicare covered employment do not pay for Part A once they've enrolled. Those who do not have 40 quarters pay the following premiums below. And if you're a non-working spouse, you can claim under your spouse's earning record. So most non-working spouses don't pay a premium. But you can see if you're under 40 quarters, we've got your premiums for Part A here. It's bracketed depending on the amount of work history. So now let's take a closer look at Medicare Part B coverage. And Part B is your outpatient medical coverage. It starts with an annual deductible on the calendar year. This is $198 in 2020. This does change yearly. And most people pay a standard premium of $144.60 a month if they're single with an income below $87,000, or couples if their income is below $174,000 a year. And the Part B premium can change yearly. If you're drawing Social Security benefits, the Part B premium can be deducted automatically from your Social Security check. If you're not drawing Social Security when you're enrolled into Medicare, you can either pay a quarterly premium directly to CMS, the federal agency that manages the Medicare program, or you can authorize CMS to deduct the monthly premium electronically once a month from your checking or savings account, whichever you set up. Under Part B, that includes coverage for your outpatient doctor visits, outpatient therapy, durable medical equipment. That includes things like wheelchairs, hospital beds, CPAP machines, oxygen, that type of thing, as well as emergency room visits, most of your outpatient services, so a same-day surgery, maybe getting an MRI, CAT scan, plus your routine testing like x-rays, lab tests, blood work, etc. Those all fall under Medicare Part B, and after your deductible, Medicare pays 80% of what they approve, and you, the member, pay the other 20%, but there is no cap on how much that 20% adds up to. So let's take a look at a few things that are not covered by Medicare Parts A and B. That would be long-term convalescent nursing home care, routine dental or dentures, routine vision as far as eyeglasses for your prescription for reading, driving, cosmetic surgery, acupuncture, hearing aids, and the exams for fitting of hearing aids. And if you go to Medicare.gov, you can check there's a long list of other things that currently Medicare Part A and B do not provide coverage for. So anyway, I hope you found that helpful, folks. We're always looking to do different things. And as we go through today, we always want to thank you for taking time to watch. If you liked our video, give us a thumbs up or leave us a comment. If there's a particular topic you'd like us to make a video about, tell us that in the comment section below, and we'll do our best to make that video happen for you. Also, be sure to click the subscribe button so you'll get automatic updates on new videos as we release them in the future. I'm Daryl Russell, Agent and Director of Training at AMS. Good day, folks.